Hi guys, welcome back to my channel. It's PerfecShan, and today I'm going to tell you how to pass your NCLEX exam in 85 questions with just 3 simple resources. So how do you pass your NCLEX questions in 85 questions? So as you know, the new generation NCLEX, the minimum amount of question is 85, and in the older generation NCLEX, the minimum was 75, I believe. Now, for context, before you go any further in this video, you can always go on Google and research what the difference is with the old generation NCLEX and the new generation NCLEX, and then you can come back. Now, first of all, before you do NCLEX, there's 3 resources that you're going to need, right? And as a bonus, I'm going to throw in the 4th one, not necessarily a resource, but a quality. You need discipline. Why you need discipline? Because it doesn't make sense you have these 3 resources, but you're not disciplined enough to commit and study. So you need discipline first and foremost. Big and bold, discipline, right? After that, I'm going to suggest that you get the Remar Quick Fact book. It is sold by Remar Nurse. You can check her out on Instagram and all other platform. I believe it's the same handle. That's the first thing you're going to need. The second thing you're going to need Mark Klimek audio lecture. So his lectures, I think they're available in audio and in soft copies as well. The third thing you're going to need is Archer Review. Archer Review is the third thing. And the reason why I suggest this order, I'll tell you. Now, as I said, the first thing is discipline, and the second thing is the Remar Nursing. Now, the Remar Nursing Quick Fact book, it is going to help you to refresh your knowledge. In the front of that book, there's a 2-week study timetable there. You can always use that timetable. I use it, plus I use other timetables as I see fit. So you can use that study timetable. And remember, you were taught the topics in nursing school, so you know the topics. So the book is just to refresh your knowledge. So first, notice I said the order, Remar Quick Fact book, because you need to refresh your knowledge. Now you need to know the things, you need the knowledge in order to apply it, right? The next thing that's going to help you with your knowledge is the Mark Klimek. Now, this is going to help you refresh your knowledge as well. Mark Klimek will break down the things, the topics to you, so that it's easy for you to understand with different mnemonics or whatever, right? Once you have those 2 things locked, then you're going to get an Archer Review subscription. And the reason why I leave this for the third thing is because you need to have the knowledge in order to apply it to your practice questions. So knowledge first, and then application. Remember, nursing is all about critical thinking and how you apply your knowledge. So the NCLEX does not test your knowledge necessarily. It does, but it mostly tests how you apply that knowledge to nursing scenarios and situations. Right? So these are the 3 most important things that I suggest anybody who is preparing for NCLEX to use. Now, into my NCLEX experience. When I did NCLEX, the topics, they varied. Now, I just want to say, no 2 exam will be the same. No 2 set of questions will be the same, because when I asked my friends about the different questions that they got, it was different. Similar topics, but obviously different questions. Now, I got a lot of pharmacology questions. I got a few management related questions. I got a few pediatric questions, mostly adult nursing questions. I got a lot of case studies. I don't remember how much bow tie and trend question I got, but I got a lot of case studies, a lot of select all that apply. Now, another thing with Mark Klimek is that he'll explain to you how to answer questions. So select all that apply. You treat these questions as true or false. And to practice answering questions, I would suggest you go on YouTube and you listen to Dr. Sharon Burke. Listen to Dr. Sharon Burke. She teaches you how to answer questions. So the process of elimination, treating select all that apply as true or false, things like that. I remember the night before my exam. I did not study the night before my exam because I don't believe in studying 24 hours before. So I was relaxing. But I was on YouTube just watching some videos, not necessarily studying, but listening and looking. And I remember there was a pharmacology scenario. And what I used to remember, and it was helpful in my exam, she said that let's just say someone came in, you got a scenario that someone came in with some symptoms. Let's just say they're having diarrhea, vomiting, and elevated temperature, right? And they list a medication. You don't know what this medication is for, but let's just say the question say, what are some findings that a nurse would expect after giving this medication? Now, a tip that she gave was to choose the answers where the symptoms were improving. So, I choose the answer where the patient has less episodes of diarrhea, they have a decreased temperature, so the fever was, slowly going away, and they weren't vomiting anymore. No, I did not know nothing about this medication, but that's a technique that I used to answer the question. So you can always watch some of her videos. There's no harm in watching videos. You can never know too much. You can never know too much. Also, it's good to remember, it's good to know the different heart rhythms and the different medication for each cardiac patterns. What I should also mention that the NCLEX is marked on a graph. Now, I'm going to try my best to explain it. Let's just say this is a graph, right? This is your starting point. Say you got your first question correct, you go up. You got your second question correct, you go up. Third, fourth, fifth, right up to the 10th question correct, you go up. Let's just say for whatever reason you got one incorrect, you go down. Now, on this graph, they have a standard. If by the time you reach 85 questions, you are above their standard point, you pass and the computer will shut off. If by the time you reach 85 questions, you are below their standard point, the computer may continue giving you questions to give you a chance to redeem yourself. But if you're so below, like dirt low, the computer can still shut off at 85 questions because it has gained enough information to conclude that you're not going to pass. So it doesn't make sense to give you any more questions. So this is how persons can fail in 85 questions. When you go to do your exam on the day, you won't be allowed to bring anything into the examination room. I don't know if this is the same for all testing centers, but it's safe to assume that it's one standard across the board, so it is the same. So when I went to do my exam, you should have your ID. For persons like in Jamaica who will be traveling overseas to do their exam, your passport is the best recommended ID. So you present your passport, they're going to give you some rules to read, and then they're going to take these things and put them in a bag, I believe, and put them in a locker. So the only thing you bring into that examination room is your brain and your fingers. Nothing else. They scan your palm, I think they scan your fingerprints, they take a photo of you, and that's just standard procedure to admit you into the examination room. When you're in there, I think they give you, I don't remember if it's a paper or it's a little whiteboard in case you need to write or do any working out. So that's that. So another thing though, exam fatigue, it's very, 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 very real. Now, personally, because I was practicing my questions on Archer Review, I knew that once it touched a certain amount of questions, at this point I don't remember, but I would have probably stated it in another video somewhere. But once it touched a certain amount of questions, I start to get so fatigued and sleepy. So because I know this, when it reached at that point, I asked to be excused. All the procedures and protocol were followed, and I went to use the bathroom, washed my face, and I came back. So it helps to wake you up. Because if I continued in that exam, I knew that I would at some point be dozing off, believe it or not. So it's good to practice so that you can identify these things in yourself. It's good to be self-aware because in a scenario, in a situation like this, it is really helpful. So in conclusion, as I stated before, guys, 3 resources, and the order I recommend it in is the Quick Fact book from Remar Nursing, Mark Klimek audio notes or soft copy notes, just Mark Klimek audio notes, whatever you're using, Mark Klimek, right? And once you have these 2 things to refresh your knowledge, it's time for you to apply it in some practice questions on Archer Review. For all the persons doing their NCLEX, best of luck to you. I really and truly hope you pass in your first attempt in 85 questions. And pray. It might seem like such a simple little thing, but pray, it actually helps. So best of luck to all the nurses who are aiming to be USRNs or wherever you are. All the best to you. Please remember to like this video, share this video, subscribe, as I'll be posting more nursing related things. And feel free below to leave your questions in the comment section and I will try to answer it to the best of my knowledge. Okay, bye.